Hi, my name is Emily Jacobius, and this is an informative guide to depression disorders. At the end of this presentation, you should be able to understand what depression is, how common the depression mood disorder is, and how to treat depression mood disorder. What is depression? Depression is a common and serious mood disorder. It causes severe symptoms that impact how you feel, think, and handle daily activities such as sleeping, eating, and working. To be diagnosed with depression, the symptoms encountered must be present for a minimum of 2 weeks. Symptoms of depression include persistent sad, anxious, or empty mood, feelings of hopelessness, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy, moving or talking more slowly, feeling restless, changes in appetite or weight, thoughts of death and suicide. Depression can be diagnosed by a doctor. The patient will be asked a series of questions before receiving a diagnosis. Sometimes a doctor will order blood work and other diagnostic tests to rule out other possible conditions. "15 million people are living with depression in the U.S. today. Did you know that depression affects 2 times as many women as it does men? Teenagers and adults are also more likely to suffer from depression versus the elderly and children." There are many different types of depression. These types include major depression, postpartum depression, chronic depression, bipolar depression, seasonal affective disorder, and substance-induced mood disorder. One of these types is not more severe than the other. Major depressive disorder is classified as following a severe event or trauma. 1 out of 6 people in the U.S. will succumb to major depressive disorder during their lifetime. And as stated before, women are twice as likely as men to develop a major depression disorder. Postpartum depression occurs after a woman has a child. This can be caused by changes in sleep patterns and hormone levels. Stress from parenthood can also be a contributing factor, as well as feelings of overwhelming. Chronic depression is depression that lasts for more than 2 years. The initial onset of depression can be initiated by a traumatic event or a circumstance. During this time, antidepressants may be used to help treat the depression disorder, but they may not be fully effective. Bipolar disorder is characterized as having extreme highs and extreme lows. These are known as episodes of mania and depression. During a manic episode, one may experience elevated mood and extreme irritability. Seasonal affective disorder, otherwise known as SAD, is caused from a lack of light that can induce depression. Seasonal affective disorder usually occurs during the winter months. It can be treated with light therapy, drug therapy, and psychotherapy. Substance-induced mood disorder is caused by medicines that may lead to depression. Usually, substance-induced mood disorder is not caused by the use of illicit substances. Children and the elderly are most likely to suffer from this, as they are more likely to suffer adverse effects from medications. There is no one cause of depression. However, we do know that some risk factors are personal or family history of depression, major life changes, trauma, or stress, certain physical illnesses, and medications. There is no one cause of depression, and depression does not discriminate against age, race, gender, ethnicity, or religion. There are many different treatments of depression. These can include medications such as antidepressants, psychotherapy, otherwise known as talk therapy, brain stimulation therapies, light therapy, exercise, alternative therapies, self-management strategies, and mind, body, and spirit approaches. Drug therapies include medicines such as selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, and tricyclic antidepressants. Selective serotonin reuptake inhibitors are most commonly used because they show less adverse effects than their counterparts. What to watch for. Individuals who suffer from depression can also become suicidal. Suicidal thoughts are thoughts that can lead one to want to take their own life. While antidepressants can be used to help stop suicidal thoughts, they can also sometimes induce suicidal thoughts. The National Suicide Prevention Hotline is a hotline created to help individuals suffering with suicidal thoughts. There are many other hotlines with this cause that exist, but the National Suicide Prevention Hotline is filled with trained professionals who are certified to help people experiencing suicidal thoughts. There are many warning signs of being suicidal. These include talking about wanting to die, feelings of hopelessness, feelings about being trapped, sleeping too little or too much, displaying extreme mood swings, and the increasing use of alcohol or drugs. If you notice these signs, please reach out to a professional promptly. There are many resources available for people suffering from depression and suicidal thoughts. These include the National Institute of Mental Health, the National Alliance on Mental Illness, and the American Foundation for Suicide Prevention. All of these resources provide helpful information about treatments of depression and what to do if you or someone you know is suffering. Listed below are the sources used for this presentation that also provide many insightful looks into depression and its treatments. I encourage each and every one of you to look further into this mood disorder so you know how to help yourself and others.